Namaste viewers, welcome to Sri Anantha YouTube channel. In this episode, let us ask Swamiji about the migraine problem. Swamiji, could you please enlighten us about the reasons and symptoms of migraine?
Embodiments of love. Today we are going to speak about migraine. Migraine is a headache disorder, as we know very well, and symptoms such as nausea, vomiting, sensitivity to light and sound, and visual disturbances. There are several potential causes for migraine, which we can say genetic factors. Migraine can run in families, indicating a genetic predisposition to the condition, or otherwise hormonal changes, fluctuations in hormones, particularly in men's testosterone, and in ladies estrogen can trigger migraines in some individuals. This is why many women experience migraines around their menstrual cycle or during pregnancy. Triggers like certain environmental or lifestyle factors can trigger migraines, especially the stress or lack of sleep, bright lights, strong smells, certain food or food additives, alcohol and caffeine. Some changes may take place in the brain through chemicals. Imbalances in the brain chemicals such as serotonin can contribute to the development of migraines. Neurological abnormalities, when we speak about migraine, may be caused by neurological abnormalities such as hyperexcitability of nerve cells or abnormal blood vessel constriction and dilation. And in certain cases, medications. Some medications, which we can say birth control pills, can also lead into migraine. And head injuries, traumatic head injuries or concussions can increase the risk of developing migraines. Certain medical conditions such as hypertension, sleep disorders and depression are associated with increased risk of migraines. So the major symptoms can vary from person to person, and such causes we can find out like headache. So it is characterized by throbbing or pulsating pain, often one side of the head. The pain can range from moderate to severe and can last for hours together. For certain people, sensitivity to light and sound. Many people experiences the migraine pain due to increased sensitivity to light, which we call it as photophobia, and with sound also phonophobia during an attack. And third, we can say it is nausea and vomiting. Mostly due to gastrointestinal disorder symptoms such as nausea and vomiting, some individual may experience a loss of appetite or feel an aversion to certain foods during an attack. And aura also can trigger migraine attack. Usually visual disturbances, some when they see some flashing lights, zigzag lines or blind spots. Like that, it may have an impact over symptoms like tingling or numbness in the face or limbs, or sluggish speech or confusion. And dizziness and vertigo can also trigger migraine. Migraine can sometimes cause the feeling of dizziness and vertigo. Mostly the aged people or 30 plus people who always ride car or scooter, they may find vertigo issues, or those who sits on the laptop for a long hours. And fatigue is one of the cause, because they may feel tired, exhausted after migraine attack, which may persist for several days also. And in certain cases, whenever there is a change in the blood flow or in the blood vessels in the brain, that can also trigger migraine. and these are especially related to the arteries, but for migraine it is not mentioned anywhere any particular artery. Whereas what generally we experienced while treating the patient is the major arteries, the carotid artery. Especially in the carotid arteries, when we find any constriction in the blood vessels, definitely one side of the neck may pain, or in the middle or the frontal part of the brain also. And any changes in the blood flow through the carotid arteries such as constriction or dilation can be associated with migraines. And second artery is the basilar artery, which is the main artery for the entire body, and in which the union of two vertebral arteries that supplies blood to the back of the brain, including the brainstem and visual centers. Migraine that affect back of the head or cause visual disturbances may be related to changes in the blood flow through the basilar artery. During a migraine attack, there is often complex interplay of blood vessels, dilation and constriction. The exact mechanism underlying migraines are still not fully understood, and there are likely multiple factors involved in their development, including genetics, neurotransmitter imbalances, and trigeminal nerve activation. So any such factors, whatever we have found, are the causes that only leads to migraine, and through Marma Chikitsa, definitely this migraine can be resolved within 4 to 5 days. And everyone who had underwent the treatment with us, they found that in their life for several years, whomever had suffered with migraines, after the treatment protocol was over, they are relieved from the migraine forever. So viewers, now today what we have discussed about the migraine symptoms and the causes, all you have experienced with this discussion. Kindly do visit our hospital and our clinic, and the address and the phone number are mentioned below, and you can experience and relieve from the migraine forever.